We are now in very good hands to start our opening ceremony.
On behalf of the FP 2030 East and Southern Africa Regional Hub and the Northwest and Central Africa Regional Hub, I welcome you all to this first FP 2030 Anglophone Focal Point Workshop. It is such a pleasure to be here in Uganda, the beautiful country that we know is called the Pearl of Africa. We appreciate the warm welcome.
Our vision is universal access to family planning to help Ugandans attain the middle-income countries. The knowledge of contraceptive methods is nearly universal, as I've indicated, but however, there remains acute gaps in substantial barriers to actual uptake of family planning. If only modest investment in family planning and education can make a very aggressive economic and government policies and gross domestic product in Uganda to be projected to reach to over 6,000 by 2040.
FP 2030 is a global movement dedicated to the rights of people everywhere to access and use reproductive health services. We represent a partnership of governments, development partners, civil society, youth-led organizations, and other stakeholders. Today, we have the privilege of gathering here with some of those partners drawn from 16 countries from East, Southern, and West Africa.
Family planning does more for a woman, for a country, for gender equality, for a family, and for society. I believe the movement that was created way back in 2012, it's growing. When you look at our region and when you look at low middle income countries, more than 1 billion women of reproductive age live and reside there. And of these, an estimated 371 million women are now using modern contraception. The number of girls who can stay in school, what a girl can do when they've got contraception, deciding to complete school and go to college, for me, that is achievement. The number of women who can land their dream jobs because they've got acts, they can decide how many children they want, when they want those children. The number of men, I don't want to leave men behind, right? The number of men who are knowledgeable and they are supportive partners in their own and their partners' fertility journeys.
We have been part of the journey for over 20 years back, and we have been able to promote the cause of bridging the gap between the religious leaders, cultural leaders, and the family planning unit.
Countries should take ownership of family planning financing as development partners also continue to grapple with the emerging priorities which they have to make sure they allocate resources to. Coming together gives us the opportunity to share learnings with the country FP 2030 commitments, lessons learned, and best practices. The government of Uganda strongly believes that investing in family planning is key for harnessing the demographic dividend of Uganda, and Uganda has a roadmap to that effect.
We are working together for a future where all people everywhere have the freedom and ability to access and make their own informed decisions about using modern contraception and whether or when to have children, lead healthy lives, and participate as equals in society and its development.
One of the challenges that, when you talk to people around about family planning programs and other programs in the region is this relative lack of regional coordination, because we tend to kind of operate like individual entities And when we do that, divided, we kind of fall apart. But if we can all be together and work and look at these issues more collectively, I think we can have a much more lasting impact at the regional level and also at the country level. And we see that, the approach that FP 2030 has adopted of having regional hubs really helps to kind of begin to create that opportunity and the platform through which, those regional cooperation, peer-to-peer learning, exchanges and all that can take place, and we can share the resources that we do have and optimize them.
Ladies and gentlemen, there are many missed opportunities to accelerate family planning access. Let us overcome these divisions that exist in where we work, and as an African, I'm aware of the impact of climate change, and we need to respond accordingly by making sure that family planning is accessible even in environments where people are facing climate change and political crisis in our communities. We need to ensure that women in crisis settings especially have access to life-saving family planning services, and that family planning programs are resilient so that they can withstand those frequent shocks.
From what we learned from the session, we decided during our group discussion, we decided that we will be able to develop and promote a legislative agenda to foster family planning and sustainability in the country, because we have a problem of turnover of government when new government comes. So we have the challenge of being able to continue to advocate for family planning.
I now see myself in a world such as this, when adolescent pregnancy is very hard. So my passion is really to live in a world where adolescents and young people can make informed decisions about their sexuality.
It is important to know that some of the countries even signed an MOU between the Ministry of Health, Ministry of Education, Ministry of Youth and Gender, are really MOU to really implement this work.
As focal points, you have a critical role in terms of facilitating the commitment-making process for your countries. Once your countries have launched the commitment, you also have an ongoing role to facilitate the implementation of that commitment.
We identified that the gaps that are there, but also it enabled us to include preparedness within the national reproductive health policy, which now in perspective, it's quite good for us. And we also identified that we do not have enough capacity, and which we are currently working with the Ministry of Health, taking lead in building the capacity of the healthcare workers at the subnational level, what we call the counties.
We need to engage the private sector more because their contribution in our country is very low. It's about 13%.